Welcome to the Dental Pro Tech Talk, the ultimate show for dental professionals staying on the cutting edge of dentistry and technology. Join us as we explore the latest advancements from soft tissue diode lasers and teeth whitening to imaging breakthroughs and beyond. We're here to help you future-proof your practice and deliver exceptional patient care. Whether you're a dentist or hygienist, this podcast is your go-to resource for tips, growth, and all things tech.
Welcome back, everyone, to Dental Pro Tech Talk. Today, we're going deep on a webinar all about using diode lasers in endodontics by Dr. Vinisha Pandey from India.
Oh, yeah, I saw that one.
Dr. Pandey is an associate professor at Maharana Pratap Dental College and a consultant endodontist at Fortis, Delhi. But her credentials, they go way beyond that. She holds certifications in dental lasers from the University of San Francisco, California, an associate fellowship from WCLI, New York. She's also earned a master's in laser dentistry from Sigmund Freud University, Vienna, Austria, and a diploma in facial aesthetics from the American Academy of Facial Aesthetics. And on top of all of that, Dr. Pandey has completed CPDs in lasers and dentistry from the University of Genoa and Eastman Dental Institute, London. She's also authored and co-authored multiple books on lasers and endodontics, and she's even been featured in the Hindustan Times for her contributions to dentistry. So it's safe to say she knows a thing or two about this topic. Today, we'll be focusing on those practical applications of diode lasers in endodontics. She really laid out a strong argument for this technology.
Yeah, I thought it was really interesting.
She dives right in, talking about how diode lasers can actually help solve some problems we've been struggling with in endodontics.
Yeah.
Especially when it comes to cleaning the root canal system.
Right.
And she starts out by, highlighting this issue of root canal failures that we keep seeing even when we're super careful with our traditional techniques.
Yeah, that's always frustrating.
It is, and she even points out that there are studies that show Enterococcus faecalis is still present in like a third of failed root canals.
Wow, a third.
Yeah, it's pretty sobering.
Yeah, you really can't underestimate how important it is to get that root canal system clean.
Right, and it's not just about, one type of bacteria either. It's also about the anatomy that we're working with. All those little tiny branches and all the hidden nooks and crannies make it really difficult to disinfect completely.
It really is like trying to clean a tiny little maze, isn't it?
It is. Even with sodium hypochlorite, our go-to irrigant, we're limited in how well we can reach all of those areas.
Yeah, that makes sense.
And then, it's not just about technique either. Dr. Pandey points to research showing that even with our traditional instrumentation techniques, we're still missing like 35% or more of the canal surfaces.
Wow, I didn't realize it was that much.
Yeah, that's a lot, and no wonder those bacteria can hang on in there.
So that's where this idea of activated disinfection comes in. Dr. Pandey talks about how it's trying to overcome those limitations with our traditional methods. And lasers, they're a big part of that new approach.
Yeah, so let's talk lasers.
Yeah.
Dr. Pandey is a big proponent of using them in endodontics, and she really highlights some advantages.
Yeah, for sure.
She mentions a study that found that 810 nanometer diode lasers achieved almost 99% bacterial reduction.
Wow. Almost completely.
Yeah, it's really impressive.
That's amazing.
But it's not just about, just blasting away the bacteria diode lasers. Can also improve disinfection by actually getting deeper into those dentinal tubules and the accessory canals, the areas that traditional methods have trouble with.
So they're getting into those areas we were just talking about missing.
Exactly. And they do it in a minimally invasive way.
That's great.
Dr. Pandey really emphasizes that lasers help us keep more of that dentine intact, which means stronger teeth and potentially fewer restorations later on.
Makes sense. We want to preserve as much of that natural tooth as we can.
Exactly. It's not just about getting rid of the infection. It's about keeping the tooth healthy long term.
Right.
And she's careful to point out that there are actually two different ways to use lasers in endodontics.
Okay, interesting.
First, you've got your conventional laser endodontics, which is basically like a dry disinfection.
Okay.
And then there's laser-activated irrigation, where you use the laser to actually heat up the irrigant.
Okay, I'm curious to hear more about that.
Yeah, and it seems like Dr. Pandey's preferred technique is the laser-activated irrigation. She spends a good chunk of the webinar going into her specific protocol for that, breaking it down step by step.
That's really helpful.
She even talks about the power settings and the fiber tips and the importance of moving the laser carefully.
So it's almost like you're getting a personal lesson from her.
It really is. And I think that level of detail is so helpful, especially for dentists who are maybe new to using lasers in endodontics.
Absolutely. She doesn't just tell you what to do. She explains why you're doing it.
Right. And then to really bring it all together, she shares these case studies from her own practice where she used laser-activated irrigation and the patients had really positive results.
So you can see how it actually works in a clinical setting.
Exactly. And the cases she chose are really interesting, even situations where traditional treatment had failed, and she's able to go in with this laser technique and see some real healing.
That's awesome.
And it's not just anecdotal evidence either. She backs it up with research.
Yep.
She talked about one study that found that sodium hypochlorite on its own only disinfects to a depth of 130 microns. But the lasers can go way deeper.
That's a huge difference.
It really shows, how these lasers can get to those little bacterial hideouts that we might miss otherwise.
Yeah, and that makes a big difference when you're trying to prevent reinfection.
Absolutely. So we've covered a lot so far, from the limitations of traditional root canals to the potential of these diode lasers, and I think it's really exciting.
Yeah, for sure. It's a lot to think about.
It is, but I think this technology has a lot to offer.
Yeah, I'm interested to see where it goes from here.
Me too.
So what else does Dr. Pandey talk about in the webinar?
Well, in the next part, she really dives deep into her protocol for laser-activated irrigation.
Okay, let's get into it.
All right, so we're going to walk through all those key steps, and she has some great practical tips that I think will be really helpful.
Sounds good. I'm ready.
All right, so let's jump in. So first things first, Dr. Pandey really emphasizes the importance of isolation. Of course, got to have that rubber dam.
Absolutely no exceptions, she says.
Right. Keeps everything nice and clean and protects the patient too.
Exactly. So once you've got the tooth isolated and you've prepped the access cavity, she recommends using a small file to figure out the working length.
Okay, so you've got your reference point for the laser.
Right, and that ensures that you're reaching that apical third of the canal.
Okay, makes sense. And then what?
And then comes a step that I thought was really interesting. She actually recommends preheating the sodium hypochlorite.
Oh, really?
Yeah, she suggests bringing the solution up to about 70 degrees Celsius using a warm water bath before you put it in the canal.
Huh, I've never done that before. Why does she recommend that?
Well, she says it actually makes the sodium hypochlorite even more effective at dissolving tissue and killing bacteria.
Oh, so it's like giving it a little boost.
Exactly. So once you've got your preheated sodium hypochlorite ready, then it's time for the laser fiber.
Okay, so what kind of fiber does she use?
She likes to use a flexible 200 micron fiber tip.
Okay, so it can get around those curves in the canal.
Right. She's careful to emphasize the importance of choosing the correct fiber size to deliver enough energy to the area without overheating the surrounding tissues.
So now you've got your irrigant ready and your laser fiber all set. What happens next?
So you've got your fiber in the canal, and you're introducing the sodium hypochlorite slowly.
Right. She uses a syringe with a side venting needle to make sure the irrigant doesn't go beyond the apex.
That's smart. You don't want to cause any unnecessary discomfort for the patient.
Exactly. Always got to minimize that trauma.
So then you activate the laser.
Right. She uses a continuous wave setting at about 2.5 watts.
Okay, and what does that do?
Well, that setting heats up the sodium hypochlorite and creates this cavitation effect inside the canal.
Oh, that's cool. It's probably what helps it get into all those tiny spaces we were talking about.
Exactly. And she says to use a slow circular motion with the laser fiber going from the apical third up towards the crown. And she recommends spending about 20 seconds in each canal.
So there's a real technique to it. It's not just point and shoot.
Right. It's all about those controlled movements and that precise timing.
Makes sense. And is there anything else she does during this part of the procedure?
Yeah, she has this interesting tip. She actually recommends not using EDTA during this laser-activated irrigation.
Oh, why not?
Well, apparently when you combine EDTA and sodium hypochlorite, it can create a byproduct that actually stains the dentin.
Oh, so it's better to just stick with the sodium hypochlorite for this part.
Right. And then once you're done with the laser activation, you rinse the canal with saline to get rid of any leftover debris.
Okay, so you're basically cleaning up and getting ready for obturation.
Exactly. So that's the basic protocol. But Dr. Pandey also talks about some of the things that can go wrong, the potential risks with lasers and endodontics.
Right. There's always a chance something could happen.
One thing she mentions is tip breakage.
Oh, yeah. That's a scary thought.
Yeah. It can happen if the fiber tip hits something hard in the canal, like a calcification.
So how do you avoid that?
Well, she says to be really gentle and careful when you're moving the laser fiber through the canal.
Okay, that makes sense. And she also recommends checking the fiber tip before and after each use, right?
Exactly, just to make sure it's not damaged.
Smart. And what if a tip does break?
She says if that happens, don't try to get it out yourself.
Oh, yeah, that's probably best left to a specialist.
Right, in that situation, you'd want to refer to an endodontist who has the right tools and the expertise to take care of it.
Definitely better to be safe than sorry. So she really covers all the bases.
She does. And, it's not just about the technical stuff. She also shares some really interesting case studies that show how well this laser-activated irrigation can work.
Oh, yeah. Those are always helpful to see how it all comes together.
Yeah, so let's talk about those cases next. Okay, so let's get to those case studies.
Yeah, I'm really interested to hear about these.
Yeah, me too. So one that really stuck out to me was a patient with a mandibular first molar that was just really infected.
Oh, wow.
Yeah, and this patient had already had traditional root canal therapy, but the infection just wouldn't go away.
Sounds like a tough one.
Yeah, they had a lot of pain and swelling, and the x-ray showed a pretty big periapical lesion.
Oof. Yeah, that's not good.
And this is where Dr. Pandey thought that laser-activated irrigation could really help.
So what happened?
Well, she went in and, followed her protocol really carefully, made sure everything was clean and disinfected.
Okay.
And the results were really impressive. The follow-up x-rays showed that the lesion was healing really well, and the patient's pain and swelling were completely gone.
Wow, so it really made a difference.
It did. And then she talked about another case that I thought was really interesting. This one was a patient who had a history of failed root canals.
Oh, wow.
Yeah, this poor patient had gone through multiple retreatment procedures, but the infection just kept coming back.
Oh, it's so frustrating when that happens.
It is for everyone involved. And Dr. Pandey suspected that maybe the previous treatments hadn't really gotten to all those little nooks and crannies in the canal system.
Yeah, it's easy to miss those spots.
Right. So she decided to try laser-activated irrigation as kind of a last resort.
Okay.
And guess what?
It worked.
It did. The infection finally cleared up, and the tooth healed up beautifully.
That's awesome. So she saved the tooth.
She did. It's really amazing. And, it's not just these individual cases that are showing positive results. Dr. Pandey also talked about a bunch of studies that support the effectiveness of laser-activated irrigation.
Oh, that's good to hear. So it's not just anecdotal evidence.
Right. She mentioned one study in the Journal of Endodontics that found that this technique significantly reduced the number of bacteria in infected canals compared to traditional methods.
Oh, wow. That's significant.
Yeah. And there was another one in the International Endodontic Journal that showed that laser-activated irrigation actually helped the sodium hypochlorite get deeper into those dental tubules.
Which is exactly what you want.
Right? You need to reach those areas to really get rid of the bacteria.
It sounds like Dr. Pandey makes a pretty strong case for using lasers and endodontics.
She does. She even says that she thinks diode lasers will become the standard of care in the future.
Wow, that's a bold statement.
It is, but when you think about all the advantages we've been talking about, better disinfection, less invasive, faster, healing, the potential to save teeth that might have been extracted otherwise.
That makes sense.
Right. It's hard to argue with the potential benefits, but of course there are always challenges when it comes to adopting new technology.
Yeah, like what?
Well, the cost of the equipment for one thing, and then you need to train everyone how to use it properly.
Right.
And there's always going to be some resistance to change. Some people are just comfortable with the way they've always done things.
That's true. But how do we overcome those obstacles?
Well, Dr. Pandey thinks that education is key. The more dentists learn about these lasers and see the evidence, the more likely they are to start using them.
Makes sense. And hopefully as more people start using them, the cost will come down too.
Yeah, exactly. And I think we're already starting to see a shift in the field. Diode lasers are becoming more and more common.
That's great to hear.
Yeah, and one last thing that Dr. Pandey really emphasized was that you shouldn't just focus on the brand name of the laser.
Right. It's about what it can do.
Exactly. She said dentists need to really look at the technical specs.
Yeah.
Things like the wavelength and the power settings and the fiber tip options.
You can find the one that really fits your needs.
Right. It's all about finding the best tool for the job.
Well, this deep dive into Dr. Pandey's webinar has been really eye-opening. I'm really excited about the potential of diode lasers in endodontics.
Me too. It seems like this technology can really make a difference for our patients.
Absolutely. Thanks for breaking it all down.
Of course. And thanks to all of you for joining us on Dental Pro Tech Talk. We'll see you next time for another deep dive.